On a lady with a varus knee, a pretty classic varus knee deformity. We've done our exposure. We're ready to put in our navigation pins. And we're going to put the tibial navigation tracker on as well. These are the first iteration. They're going to get better with the next iteration coming out soon. Get the black handled screwdriver. So the first screws sink the pin box down to the bone with compression. And then I'm using this second screw to add stability. It's a little bit bigger. The real critical part of this is you want to make sure that these are well fixed to the bone without any motion. If these are moving relative to the bone, obviously none of the information you're going to get is going to be worthwhile. So now that we've got our navigation trackers fixed to the femur and the tibia, now we're going to go through our bony landmarking. So we've already registered the navigation trackers, the tibial and the femoral marker, as well as the stylus and the paddle to the headset with QR codes. So up here in the top, we're going to click on landmarking. I've got audio that's going to navigate me through, but also, as you can see on the streaming feed, it's going to tell us what landmarks are next. So the femoral head center is pretty easy to capture. The headset needs to see the femoral marker. And there's an audible beep when that's been captured. This is the stylus. So when I'm landmarking the femur, the headset needs to see the femoral tracker and the stylus at the same time. Let me switch spots. We're going to adopt a painting strategy. So we're painting the lateral femoral condyle right on the surface. You can hear the little clicks as data points are being acquired. The point of painting a wide area is you want to capture the most distal aspect of the condyle. So we're giving it multiple options. Same strategy for the medial side. As long as we're moving, the headset continues to acquire data. When we think we've acquired the data, we simply pause the movement. Let me switch. I'm going to come down here and look at the stuff that's acquired. It's a little hard to see when the lights are on. Here we go. We can see the condyles now, and we can see that we've done a good job of capturing the distal condyles with the painting strategy. Posterior condyles are a single point at present.
Anterior cortex.
So our femoral registration is done. We're going to move to our tibial registration. So now the headset is trying to recognize the tibial marker and in the same stylus. And these last 2 points give us our center of the ankle joint. Okay, so the bones have been registered. We're going to move on our touch screen to the assessment. We're going to confirm our landmarks are appropriate. I'm going to bring this touch screen just a little bit closer to the field so I can see it. Okay, so we are seeing our current alignment. This knee is starting in 4.5 degrees of varus. We're going to hit the capture the pre-op, 4.4 degrees of varus. And here we're seeing our live gaps. So the live gaps are the smaller number, and the max gaps that we're capturing are the larger number. So we've got about 3 millimeters of distraction on the medial side to a valgus stress. Okay, and now in flexion, do the same thing. So we'll get as close as we can to 90 degrees of flexion. So we're going to do our soft tissue gap on the medial side. And our soft tissue gap on the lateral side. Try to capture max soft tissue laxity there. And so now we've acquired both our bony and our soft tissue registration. So we're going to go to our planning screen. The good thing about this system is it's implant agnostic, and it's also philosophy agnostic. So I'm going to use a fairly kinematic approach to planning this knee. I'm looking at how much cartilage wear there is. We've got a pretty normal lateral condyle. We've got a pretty eroded medial condyle with near full thickness loss. So in planning this, I'm going to aim to take (9 millimeters from the medial side, 7 millimeters from the, 9 millimeters from the lateral side, 7 millimeters from the medial side. So one of valgus and the femur to achieve that. We're going to internally rotate the femur to keep our 9 millimeter resection laterally and get to about 7 millimeters medially. And then our tibial resection, 2 degrees of varus. So it's a mild oblique joint line, a degree of valgus on the femur, 2 of varus on the tibia, overall plan for 1 degree of varus. What's that? Okay. So if we're happy with our resection depths, we can move on. I'm going to get my retractors in. Technology in a headset to pin cutting guide exactly where we want it. So we're going to initially fix the universal resection guide, the URG, to the bone. And the goal here is just to have a stable platform. This cutting block is going to be able to move into the planned position by navigating it with this paddle instrument. So I'm going to switch places. We're going to put this instrument into the cutting slot. And now through the headset, I'm able to see live what our values are. And initially we pinned this, not exactly in the right position. We were just kind of guessing. But by adjusting these little dials, we're able to make small modifications to our planned cut. And within just a few seconds, we're very close to our planned resection. You hear the headset beep? We're real close. We're within tolerance right now. So I'm going to aim to be a little bit better, to be as close to perfect as we can. So we're like 0.1 degrees off, 0.1 degrees off, and we're like 0.3 millimeters off. So I'm really happy with that. Obviously there's going to be more air introduced with the saw blade than that. Okay. So with the cutting block in the right spot, we're going to pin it to the bone with 3 headless pins, trying to not move this at all from where we have navigated it. So we're going to use these smooth pins. Do something. Here's a magnetic driver piece. You might take those 2 magnetic pins out. So we'll confirm once we remove the universal resection guide. I think it's something 7. So with the resection guide off, we've just got the cutting block left. This is a very, similar cutting guide as we would use with manual instrumentation. It's just been navigated to our chosen desired location. And you can see we pinned it, we're 0.4 degrees off in flexion, we're 0.1 degrees off in valgus, we're under resecting by about 1 millimeter under resection from how it's pinned. Holding that over there. So we're going to cover up these spheres in the navigation with trackers. We've done our distal femoral resection. Give the headless pin driver back, please. I'm going to take this stuff out, and then we'll confirm our cuts with the paddle instrument. So this is our best way to confirm that we've done our resection as planned. And you can see we ended up with a resection that's 0.3 degrees off in flexion, 0.7 degrees off in the coronal plane, spot on our lateral side, and about less than a millimeter off medially. So very close, all certainly within spec, as close as we achieve with robotics. Empty pin driver back, please. So we've navigated that distal femoral resection beautifully. We're going to adopt the same strategy for the tibial resection. So we'll expose our tibia. Okay, so we'll take the universal resection guide. It's universal because it's used for both the femur and the tibia. Okay, so this is well fixed to the tibia. On our planning screen, we're gonna move to our tibial resection. Put the paddle into the cutting slot. And here you can see we're cutting anterior slope, so we're gonna change that to posterior slope. We plan for 3 degrees of posterior slope. We plan for a 2-degree varus cut. We're now achieving it. Now we're just taking a little bit too much bone. We're going to back it off a little bit. There's our beep. Spot on. We're going to move the resection cutting guide close to bone. You can probably see from the helmet, this has 2 little holes. I'm going to put this into the anterior-most hole. I'm sorry, the posterior-most hole. So I can move this guy closer to bone. The closer we are to bone, the less error we're going to have. And that's great. Take this off. Same thing, we're going to secure this to bone with 3 headless pins. 2 parallel. 1 oblique. To lock it. You have the magnetic fiber piece. So now we're going to verify that this is pinned in the appropriate desired spot. So if we look through here, we can see our posterior slope is spot on. We're 0.2 degrees off. Our varus valgus, we're spot on. We're 0.5 degrees off. And we are within 0.1 millimeters. So this is a really accurate cut with no extramedullary guide or intramedullary guide. It's just navigated based on our plan. Like with any manual instrument, it's possible to put the saw in here and torque the saw up or down, so we want to make sure to be coplanar with our planned cut and not torque this at all. So very coplanar. And I'll take the saw back one more time. Poker, please. So we can validate our tibial cut. We found a special treasure inside. Great, really spot on cut. I mean, like, it doesn't get more perfect than that. It really doesn't. That's like everything's 0.1, 0.2 off. That's better than robotics. You can come out here. I'm gonna put it into my extension space. And this should be pretty rectangular and pretty snug and well balanced because we planned it as such. So if we come to full extension, the spacer block fits in. I'm gonna tilt my head down so you guys can see what I'm seeing. But as we put a valgus stress on, it's a really snug space, exactly as I wanted it to be. And Illyria put a finger there. If we look laterally, same thing. Really nicely balanced extension space. We'll check our tibial alignment. We plan this to be in 2 degrees of varus. Just a little bit of varus there. Very happy with that. So it took a little bit of time to plan and make these cuts accurately, but we have done so. We have planned our flexion space. The strategy that Polaris uses is to acquire the bone and soft tissue data through the headset, but then to rely on the company's sizing guide for rotation. So we plan to take 9 millimeters off the lateral condyle and 7 millimeters off the medial condyle. So I'm gonna set this at neutral rotation, which with this particular company's cutting guide takes 9 and 9. And then we're gonna slide an angel wing underneath the medial side to take about 2 millimeters less. Since there's cartilage missing from the posterior medial condyle, we want to take a little bit less bone from there. Okay? Pins, please. So this is setting our rotation at slight internal, as we planned. Second. Good, so we're gonna leave those pins in while we size. And this is a small patient with a small femur that we're sizing right at a size 5. Okay, take the pin driver back.
I used one last week, so.
So we're gonna take the size 5
I used one last week,
cutting block,
so. Oh, you have another one.
just like we would with Rosa, just like we would with manual instrumentation, and put it into the pre-planned spot. Oh boy. There's one bad pin. Is this down all the way? It's down all the way.
No?
Yeah, softness. take the Polaris. Roger, please.
This one never comes off.
Okay, so trials are in. This is 10mm poly. Knee comes fully straight. Very stable to valgus stress. Very stable to varus stress. Patella, as you can see, is tracking beautifully centrally. Beautiful stability, A to P. So I'm going to scrub out, take my HoloLens off, come back in with the hood and put the implants in. But this is a really awesome outcome.